My name is Jennifer Decker. I'm a first-year MSAN student at the University of New England. Today, I will discuss my IRB research proposal. Lupus is a complex autoimmune disease that impacts several body systems. Autoimmune diseases occur when the body mistakenly attacks healthy cells and tissues. Evidence suggests that lupus may be triggered by various environmental factors, certain medications, viruses, and genetic factors. Lupus occurs when there is an overactive immune response. Lupus symptoms can range from mild to life-threatening, which can include rash, joint pain, myalgia, which is muscle pain, anemia, GI disturbances, nervous system dysfunction, and in more severe cases, renal damage and cardiac manifestations. There is a correlation between vitamin D deficiency and lupus. However, the causation remains unclear. Current literature indicates that lupus patients who are vitamin D deficient also have a higher measure of disease activity. Some researchers hypothesize that the association between vitamin D deficiency and lupus patients may be a product of either the limited sun exposure due to photosensitivity that can occur from the disease itself and medications, or immune modulating capabilities of those pharmaceuticals that they take, such as corticosteroids or hydroxychloroquine. However, further research that elucidates that relationship between vitamin D deficiency and SEL is warranted. In this research that specifically addresses the potential role vitamin D supplementation may have in improving clinical outcomes is needed. This upcoming IRB proposal will be aimed to focus on expanding that existing scholarly knowledge regarding lupus and vitamin D deficiency. My research question is, how does vitamin D supplementation impact anti-dsDNA levels, which are a specific biomarker of lupus, in vitamin D deficient female lupus patients between the ages of 30 and 39? The purpose of this research is to determine whether vitamin D supplementation will impact anti-dsDNA levels in lupus patients to address the potential role that vitamin D supplementation may have in improving clinical outcomes. The research will be conducted to expand upon the existing scholarly knowledge to help create health interventions to improve quality of life. Vitamin D toxicity is rare, as it is difficult to get enough from food sources and there is often limited sunlight exposure. However, deficiency is more common and symptoms include chronic hypercalcemia, hyperparathyroidism, osteoporosis, bone pain, arthalgias, myalgias, fatigue, muscle twitching, lethargy, and weakness. Some food sources include salmon, mackerel, sardines, and fortified foods such as milk, orange juice, and some breads and cereals. And again, non-food sources include sunlight. The current literature suggests that decreased disease activity is correlated with vitamin D intake in patients with lupus. A double-blind randomized control trial conducted by Fiblia et al. That studied vitamin D deficient females between the ages of 18 to 60 determined that 12 weeks of 5,000 IU of vitamin D per day increased serum vitamin D levels. Furthermore, the researchers found that the added vitamin D improved disease activity. However, this study did not measure inflammatory markers such as anti-dsDNA levels. Another retrospective longitudinal study conducted by Hassan included 51 patients with a mean age of 40.8 years. Lupus patients were given 50,000 IU of vitamin D3 once a week for 3 months. Blood samples were obtained between 2 to 3 months to measure vitamin D serum and certain autoantibodies, including the anti-dsDNA levels. This study demonstrated that serum vitamin D levels were significantly increased after supplementation. Furthermore, the resolution of the vitamin D deficiency led to a decrease in anti-dsDNA levels. Several studies have demonstrated the efficacy of vitamin D supplementation in improving lupus symptoms. Furthermore, scientific evidence does suggest that anti-dsDNA levels are associated with the disease activity. However, research that elucidates the role vitamin D supplementation may play in decreasing the anti-dsDNA levels is lacking. Anti-dsDNA levels have long been considered a hallmark of disease activity, correlating with higher anti-dsDNA levels and more symptoms. Consequently, a decrease in anti-dsDNA levels is correlated with a reduction in disease activity. Some studies indicate that higher levels of anti-dsDNA levels also are associated with renal involvement. However, it's unclear in the current literature as of now. Therefore, this study is significant because it will contribute to the understanding the role vitamin D supplementation may have on this important biomarker. 128 participants will be recruited for this study. Inclusion criteria include being female, a lupus diagnosis, current vitamin D deficiency within the last 3 months, being aged between 30 and 39 years, a positive anti-dsDNA level within 6 months, and being a part of the Penn State Health Network. Exclusion criteria include diagnosis of another autoimmune condition, participants who are already taking a vitamin D supplement, a negative anti-dsDNA level, and not being part of the Penn State Health Network. This study will be a randomized control trial in which there will be 2 groups. One group will be given a vitamin D supplement of 6,000 IU a day for 3 months. The second group will be given a placebo. All participants' serum vitamin D levels and anti-dsDNA levels will be assessed at baseline, 6 weeks, 8 weeks, and 12 weeks. Adequate serum levels of vitamin D will be considered to be greater or equal to 50 nmol over liters. Moreover, titer levels of anti-dsDNA antibodies will be considered either negative, indeterminate, or positive, and those correspond with various levels. Data collection will occur at the Penn State Medical Lab Center. Participants will get their blood drawn at their convenience during the baseline, 6, 8, and 12-week intervals. Participants will complete an electronic pre-screen to determine eligibility prior to participation. Once participants receive receipt of their eligibility, they may file the electronic consent form. To reduce the risk that participants feel pressure to participate, forms will be available for them to access at any time as long as they use the hospital computer. The consent form will notify participants that they can withdraw from the study at any time for any reason. There are a few risks to this study. One of the risks includes the potential for physical harm from not taking a vitamin D supplement with a moderate vitamin D deficiency. However, the research team will mitigate this risk by giving participants access to the results through the health portal and informing participants if their vitamin D levels drop to severe levels. Therefore, they can withdraw from the study and seek health care. The other major risk from this study is the risk of venipuncture. Getting one's blood work is associated with specific complications including infection, arterial puncture, nerve damage, and hematoma formation. One benefit of participating in this study is the participants that are given the vitamin D supplement may benefit from increasing their serum vitamin D levels. However, participants will not know which intervention group they belong to. Some additional benefits include being a part of a study that may help clinicians and researchers improve the outcomes for lupus patients. The data from this study will be analyzed using longitudinal analysis of covariance. The software that will be employed will be the SAS, which is a statistical software package created by the SAS Institute. This statistical software is well suited to analyze data from randomized control trials as it can perform simple to advanced statistics. Furthermore, this software has enhanced code editing functions to ensure the accuracy and the efficiency of data analysis. This method will be used to evaluate the differences in the treatment while also considering the baseline over the specified period for intervals over 3 months. The knowledge gained from this study is important to broadening the understanding of the complex mechanisms behind this potentially debilitating disease that affects approximately 1.5 million Americans. Furthermore, the Lupus Foundation estimates around 10 to 15% of individuals with lupus will die prematurely as a result of complications, making this one of the top 20 causes for death in females between the ages of 5 to 64. Existing research indicates that lower levels of vitamin D correlate with increased disease activity, whereas higher levels of vitamin D are associated with a reduction in symptoms. The data from this study will elucidate the mechanisms behind the role vitamin D may play in the reduction of anti-dsDNA levels and disease activity, which may contribute to interventions that include vitamin D. Moreover, data from this research study will inform future work that may contribute to the development of beneficial treatments. Treatments that are lower risk and more cost-effective are important, as lupus medications are associated with several risks, including diabetes, amenorrhea, recurrent infections, and depression. Moreover, given the role that vitamin D plays in the suppression of anti-dsDNA, this proposed research will contribute to the existing scholarly knowledge to add to clinical practice. The references used in this presentation are included here.